Obsessive-Compulsive Disorder, OCD. These three letters carry a weight that extends far beyond their simple arrangement. Living with OCD is like navigating a world booby-trapped with anxieties. It's a constant battle against intrusive thoughts and an overwhelming urge to perform rituals that promise temporary relief. Imagine a life where every action, no matter how mundane, is accompanied by a chorus of doubts and fears. This is the reality for millions around the world living with OCD, a disorder that touches every aspect of their lives. By shedding light on the reality of this disorder, we can begin to dismantle the stigma, empower those who suffer in silence, and foster a world where understanding paves the way for healing. At the heart of OCD lies a relentless cycle. Obsessions ignite anxiety and compulsions offer a fleeting escape. Obsessions are intrusive, unwanted thoughts, images, or impulses that invade a person's mind, triggering intense anxiety and distress. Imagine the unrelenting fear of contamination, the nagging doubt that you might harm yourself or someone you love, or the paralyzing need for everything to be perfectly symmetrical. These are just a few examples of the tormenting obsessions that haunt individuals with OCD. Compulsions emerge as a desperate attempt to quell the fire of anxiety ignited by obsessions. These are repetitive behaviors or mental acts that individuals with OCD feel driven to perform, often according to rigid rules or patterns. They provide a temporary illusion of control, a brief reprieve from the relentless onslaught of anxiety. Excessive hand-washing, repeated checking of locks and appliances, meticulous ordering and arranging of objects, counting rituals, and mental rehearsals are just a glimpse into the vast repertoire of compulsions. The tragedy of this cycle is its self-perpetuating nature. The more one engages in compulsions to alleviate anxiety, the more deeply ingrained the obsession becomes, tightening its grip and demanding even more elaborate rituals. OCD is often depicted as a singular entity, characterized by a preoccupation with order and cleanliness. However, this portrayal is a gross oversimplification of a disorder that manifests in a myriad of ways, each with its own unique set of obsessions and compulsions. Some individuals may experience contamination OCD, plagued by an overwhelming fear of germs, dirt, or disease. Others may struggle with harm OCD, tormented by intrusive thoughts of causing harm to themselves or others. Relationship OCD can poison even the strongest bonds, with individuals consumed by doubts about their partner's love or their own worthiness. Scrupulosity, a form of OCD characterized by religious or moral obsessions, can lead to excessive praying, confessing, and seeking reassurance. Hoarding disorder, once considered a separate diagnosis, is now recognized as a distinct manifestation of OCD. Understanding the multifaceted nature of OCD is essential to providing appropriate support and challenging the misconception that this disorder is simply about being neat or organized. Section 4. The Inner Struggle. Awareness without control. One of the most heartbreaking aspects of OCD is the profound disconnect between knowing and feeling. Individuals with OCD are often acutely aware of the irrationality of their thoughts and the futility of their compulsions. They understand on a logical level that their fears are unfounded, that their rituals are excessive, and yet they feel powerless to resist their grip. Imagine being trapped in a burning building, knowing that the fire escape is just a few feet away, yet feeling paralyzed, unable to move towards safety. This is the agonizing reality for those living with OCD. They are prisoners in their own minds, held captive by a disorder that thrives on doubt, fear, and uncertainty. The more they try to reason with their obsessions, the louder the doubts scream, and the more entrenched the compulsions become. This internal struggle, this constant battle between logic and fear, is one of the most exhausting aspects of OCD. The awareness that their thoughts and behaviors are irrational only adds to their shame and guilt, making it even more difficult to reach out for help. Section 5. Unraveling the Knot. The neurobiology of OCD. The roots of OCD run deep, entwined within the intricate circuitry of the brain. Research suggests that imbalances in certain neurotransmitters, particularly serotonin, play a crucial role in OCD. Serotonin is a chemical messenger that regulates mood, sleep, and other vital brain functions. Brain imaging studies have revealed distinct patterns of activity in specific brain regions in individuals with OCD. Areas such as the orbitofrontal cortex, anterior cingulate cortex, and basal ganglia show altered activity in those with OCD. These findings suggest that the brain's error detection and reward systems may be malfunctioning in OCD. It's more likely a complex interplay of genetic predisposition, environmental factors such as stressful life events, and neurological vulnerabilities that contribute to the development of this disorder. Section 6. Breaking Free, Treatment and Hope. The journey to recovery from OCD may be long and challenging, but it is a journey paved with hope. Effective treatments are available that can help individuals regain control over their thoughts and behaviors. Cognitive behavioral therapy, or CBT, is considered the gold standard of treatment for OCD. Exposure and response prevention, or ERP, a specific type of CBT, gradually exposes individuals to their feared situations while helping them resist the urge to engage in compulsions. Medications, particularly selective serotonin reuptake inhibitors, or SSRIs, can also play a crucial role in managing OCD symptoms. These medications work by increasing serotonin levels in the brain, helping to regulate mood and reduce anxiety. While medication alone is often not sufficient to address the underlying thought patterns driving OCD, it can provide significant relief from symptoms, making therapy more effective. In cases of severe OCD that do not respond to traditional treatments, electroconvulsive therapy, or ECT, may be considered. Finding a qualified mental health professional with experience in treating OCD is crucial for developing an individualized treatment plan tailored to the specific needs of the individual. Section 7. You are not alone. Seeking help and support. If you or someone you love is struggling with OCD, please know that you are not alone. Millions of people around the world share this experience, and there is no shame in seeking help. Reaching out for support is a sign of strength, a testament to your resilience, and the first step towards reclaiming your life from the grip of OCD. Talk to a trusted doctor, therapist, or mental health professional. They can provide a proper diagnosis, discuss treatment options, and connect you with valuable resources and support groups. Connect with others who understand. Online forums, support groups, and advocacy organizations can provide a sense of community, shared experiences, and valuable insights into managing OCD. Knowing that others have walked a similar path and found hope can be incredibly empowering. By seeking help, embracing support, and challenging the stigma surrounding mental health, you can break free from the cycle of obsessions and compulsions and reclaim your life.